How obstructive sleep apnea cause or aggravate hypertension. Intermittent hypoxia. During OSA episodes, the airway obstruction reduces oxygen levels in the blood, hypoxia. The body responds to this by increasing sympathetic nervous system activity, which releases stress hormones like adrenaline. These hormones cause blood vessels to constrict and the heart to work harder, leading to increased blood pressure. Sympathetic nervous system activation. The frequent drops in oxygen levels and the subsequent arousals from sleep activate the sympathetic nervous system. This system controls the body's fight or flight response, leading to increased heart rate and blood pressure. Chronic activation of this system can result in sustained hypertension. Endothelial dysfunction. OSA can lead to dysfunction of the endothelium, the inner lining of blood vessels. Endothelial dysfunction is a precursor to atherosclerosis, hardening of the arteries, and contributes to the development of hypertension. It is caused by the repetitive hypoxia reoxygenation cycles, which produce oxidative stress and inflammation, damaging the endothelial cells. Renin-angiotensin-aldosterone system, RAAS, activation. The RAAS plays a crucial role in blood pressure regulation. OSA can activate this system, leading to increased levels of angiotensin II, a potent vasoconstrictor that raises blood pressure. Additionally, aldosterone levels may increase, promoting sodium and water retention, further elevating blood pressure. Altered baroreceptor reflex. Baroreceptors are sensors in the cardiovascular system that help regulate blood pressure. In OSA, the function of these receptors can be impaired due to chronic intermittent hypoxia, leading to less effective blood pressure regulation and contributing to hypertension. Sleep fragmentation and poor sleep quality. Frequent awakenings and poor sleep quality are both symptoms of obstructive sleep apnea, OSA, which may lead to increased stress and higher blood pressure. One of the established risk factors for hypertension is chronic sleep loss, both in terms of quantity and quality of sleep. Inflammation. OSA is associated with systemic inflammation. The inflammatory response can damage blood vessels and contribute to hypertension. Elevated levels of inflammatory markers like C-reactive protein, CRP, and interleukin-6, IL-6, are often found in individuals with OSA. Metabolic effects. OSA is often associated with metabolic disorders, such as insulin resistance and dyslipidemia, which can contribute to hypertension. These metabolic disturbances are partly driven by the intermittent hypoxia and sleep fragmentation seen in OSA.